Okay, so looking at pathology that affects the ear, nose, and throat. Talk about hearing loss. We had spent some time talking about ways to test for the different types of hearing loss in class. So hearing loss, again, inability to hear either a specific pitch or inability to detect any sound. If it's an inability to detect any sound, that's considered deafness, but obviously there's also degrees of hearing loss as well. And as we had talked about in class, it's divided into either conductive hearing loss or sensory neural hearing loss. So conductive sound loss involves when the conduction pathway is blocked. Okay, so the canal through the ear somehow is blocked in some way, shape, or form, and that's preventing that. So it's more of a mechanical dysfunction as opposed to sensory neural hearing loss, which involves hearing loss because of some type of issue with the inner ear. So remember when we had talked about the function of the inner ear and what that means as far as hearing. So those are the two different types, and again in class we had discussed ways to test for each one of those. Otitis externa, so this is an ear infection, as we're going to talk about different types of ear infections that affect different parts of the ear. So this is an inflammation or infection of the external auditory canal and tympanic membrane. So this is what is commonly known as swimmer's ear. So this is very common in water sports. I have a couple other types of subgroups listed here. So again, structurally, this is more of an infection of the ear canal and possibly part of the tympanic membrane as well. So, and again, this will be caused in water sports because swimmers get water in their ear, and that encourages an environment where the infection can kind of take hold in that part of the ear. Okay, now otitis media is a middle ear infection. So this is fluid in the middle ear, and it's accompanied by signs and symptoms of infection. This tends to decrease with age. Most adults tend to not get middle ear infections. Many times the young kids get it because their eustachian tube is a factor in their kind of growth and development in the way their tubes are actually positioned in their ear. So they have a tendency to get these more often. Adults don't tend to get middle ear infections. Many times the symptoms occur with this simultaneously with an upper respiratory infection. So it's still not unusual for an adult, maybe with like a cold, to get some ear symptoms. But typically adults don't get bacterial ear infections, and that's another thing. Obviously the treatment for this type of infection would depend upon whether you're dealing with a virus or a bacteria. Ruptured tympanic membrane, so if you have a sudden change of air pressure, and this could be caused by a blunt trauma, so an athlete maybe gets hit in the ear, and it's a trauma in such a fashion that it actually causes a pressure wave that causes the eardrum to rupture, or just an infection that inhibits the ability to regulate the inner ear pressure. So many times infections can cause this, but again, trauma can cause this as well in athletes. And you would see this with your otoscope exam. You would actually see a small hole in the tympanic membrane. So many times before the rupture occurs, the individual will note some increased pressure and pain, and then the accompanying symptoms that would go along with this. Okay, allergic and non-allergic rhinitis. So we're moving on to the nose now. So allergic rhinitis is an immunoglobulin E mediator response to inhaled allergens. So this is commonly what you would see with seasonal allergies, for instance, and the symptoms that would accommodate that. So your signs and symptoms: the sneezing, rhinorrhea, the nasal pruritus, which is the medical term for itching, congestion. Non-allergic rhinitis typically involves an infection There's other causes to it as well. There's drug-induced, there's gustatory, hormonal. So rhinitis is basically just inflammation inside the nasal cavity. A non-allergic rhinitis tends to produce excessive mucus, whereas with allergic rhinitis tends to produce more of like the runny nose when you have this. So again, the treatment for rhinitis is going to be based upon the cause, which is you're kind of reading, you'll see the different medications based upon what the individual is presenting with. Sinusitis, again, another thing caused many times by infection, so inflammation of the mucous membrane lining of the nasal cavity or the paranasal sinuses. So we had discussed the paranasal sinuses in class and what their responsibility is. There's various classifications for this: acute, subacute, recurrent, chronic. Again, this could also be caused by bacterial and viral infections. So again, treatment is going to be associated with the cause. So obviously, if it's a bacterial sinus infection, you're dealing with something that would need an antibiotic. If it's more of a viral infection, that's something that an individual would then just kind of treat symptomatically. So deviated septum, which typically occurs from a trauma. People can be born with deviated septums as well. So we all know, again, anatomically the septum, it's the nasal septum is what kind of divides us into our right and left nostril. In the case of a deviated septum is when you're going to have the deformity where the septum is kind of not quite centered, and it can actually cause chronic nasal obstruction. So many times, obviously, if it occurs from a traumatic blow, it's going to produce epistaxis. And then the unfortunate thing is usually what happens is when you get the nasal fracture, a lot of times this gets discovered after it's healed. And obviously then if it's healed, the only way it could really be repaired at that point is surgically. So it's important to kind of note if an individual appears to have fractured their nose, to make sure that they can breathe through each side equally, so that that septum, in the case where it would have to be fixed, it gets fixed before it actually heals. So here's kind of a picture. You could actually see someone with a deviated septum. So if you look at the nostrils, not quite even in size, and you can see how the septum does not come kind of straight down the middle. It kind of deviates laterally. Okay, epistaxis, we had kind of talked about this already. This is just known as a nosebleed, so very common among athletes. Usually it will occur with trauma, however it can occur without trauma for various reasons. Just the nasal region gets dried out and it causes the bleed to occur. You have two different types of bleeds that can occur. You have an anterior bleed and a posterior bleed. We talked about in the beginning of class the structure called Kesselbach's plexus, which forms on the septum. So that's typically where most of your nosebleeds occur, from that blood vessel plexus that's on the septum. Posterior bleeds tend to be more profuse, and many times it causes a lot more bleeding, and sometimes posterior bleeds may actually require referral, because they tend to be very difficult to get the stop. Most anterior epistaxis will stop spontaneously just with the normal treatment. However, a lot of your posterior bleeds possibly may need some further treatment. Okay, pharyngitis and tonsillitis. So we're just looking at inflammation to two different parts of the throat. So pharyngitis is inflammation of the pharynx, and it's what we commonly think of just when we think of what a sore throat is. Tonsillitis is an inflammation of the tonsils. In both of these instances, again, you have to look at what what the cause may be. Many times pharyngitis is initially a viral infection, but it can be followed by a bacterial infection. That's why it's important, again, when you have an individual who is sick, who is under your care, that you're just kind of monitoring their, if they are getting better, or if they feel like they're getting better and then all of a sudden they get worse. That would be something important to note. Tonsillitis is very commonly caused by a strain of Streptococcus bacteria. So that would be important to note. Okay, laryngitis is inflammation of the larynx. Again, many different causes when you're looking at this, just like a lot of the other conditions. So common cold, bronchitis, pneumonia, influenza. This can actually also be caused by things like gastroesophageal reflux, allergies, cigarette smoke, or probably one of the more common things actually that causes laryngitis is not even an infection, but just overuse of one's voice. So, people go to a sporting event and they scream and yell for their team, and then the next day they can't talk. It's laryngitis. And again, in that instance, it's not caused by an infection, it's just caused by overuse of the voice box. So again, this could be either acute or chronic. Again, a lot of the symptoms and the treatment, just like a lot of the other things, are going to be based on the cause of the condition. Okay, oral mucosal lesions. There's many different types of these. One thing I would kind of point out is make sure in the reading of your text you kind of pay attention to some of the particular types that they do talk about. So there's going to be a little bit more depth in the text that I'm going to talk about. So look at some of the different types of the differential diagnoses for some of the different types of oral mucosal lesions, so pay close attention to them. The early identification of them is very important because, again, many times if they are caused, for instance, by cancer, again, early treatment for that is going to be very important. Many times this is also the first clinical evidence of HIV infection and AIDS, primarily because with HIV/AIDS you deal with a suppressed immune system. So if the immune system is suppressed, it does lend a person to conditions and in case infections that might cause these oral mucosal lesions or the other causes of oral mucosal lesions because of the fact that the immune system is not functioning as well. So there's some different tables in your textbooks that I'm going to point you towards to pay attention to, maybe even in addition to this talk, taking some other notes on some of the different causes of oral mucosal lesions. One particular lesion I am going to focus on and talk a little bit more here, oral candidiasis. So this is a yeast-like infection inside the mouth. It's common actually in young kids. It's referred to as thrush. The classic signs and symptoms is the white, cheesy, curd-like patch on the tongue on the inside of the mouth. And again, it's most common particularly in newborns, again, just because of their immune system is not quite as formed as an adult's would be. Again, take note of the treatment for this and how individuals would kind of deal with this. A lot of times the treatment can last for a little while. It's also very common after the use of antibiotics. So that would be another potential thing that could clue you in as to the cause of the oral lesion. Okay, oral cancers. Again, I had talked in the beginning of this. Again, make note of the differential diagnoses of the many different types of conditions that affect the oral cavity. Oral cancers can affect any area of the mouth, and there's some pictures in the book that kind of illustrate some of the different types of oral cancers and what they look like. Many of the predisposing factors, tobacco use, excessive alcohol use, poor oral hygiene, If there's a family history of oral cancers, age is also a factor. This does tend to happen in people older than 40. So again, making note of some of the different factors that can predispose people to oral cancer. Brief word about some dental conditions. So gingivitis is an inflammatory condition of the gums caused by bacteria. So very important. There's bacteria in foods. Very important to make sure, again, inadequate brushing and flossing will produce plaques that can lead to an environment inside the mouth that could possibly create an unfavorable environment for the formation of gingivitis inside the mouth. If by chance gingivitis gets left untreated, so if the inflammation of the gums continues to progress, an individual can develop what's called periodontitis. This results in what you see with a receding gum line, and then the alveolar bone which surrounds the tooth starts to deteriorate. So this is just kind of a progression if an individual does not take the appropriate steps. If they have developed gingivitis, if they don't treat that appropriately, it can progress into a further condition such as this. Okay, dental caries are what most people commonly refer to as cavities in the teeth. So anytime, again, accumulated bacteria on the enamel surface, which will initially form plaque, but then what will happen is the enamel will start to decay after a while, and it could decay to the extent where the enamel erodes into the dentin, and if it continues to further erode, it could even get into the pulp of the tooth. So that's where the person would experience some pain and discomfort with this if it continued to go on, because again, the pulp is where the part where the nerve and everything at that point would be exposed. So different types of classifications for dental caries depending upon the shape and how deep they go. So again, just when you're looking at this as far as the treatment, you can see where some of the treatment would take place here as far as how the dental caries would be handled. So that's just your background on a lot of these conditions. Now, conversationally, a lot of the description of these conditions are pretty short. So you notice that a lot of the conditions are caused, again, the treatment and everything is going to be all based upon, are they caused by bacteria, viruses, what have you. So it's really important, pay very close attention in the textbook, in your reading, to the treatments, the referral, what a lot of these conditions tend to get treated with. Also, again, for the oral mucosal lesions, make sure you look at some of the different types and what their causes are. So I did not get in depth into that here. Again, there's a table in your textbook and there's some illustrations kind of showing some of the different conditions. So please pay mind to that as you're kind of going through and reviewing your reading.